Patrick, thank you. In Texas, a second child has died of the measles virus over the weekend. This comes as the country sees a surge in cases. Doctors say the 8-year-old girl died from measles pulmonary failure and that she was unvaccinated and had no other prior health conditions. The country's health secretary, Robert F. Kennedy Jr., attended the funeral service yesterday. In a post online, RFK Jr. expressed support for the measles vaccine. He says the most effective way to prevent the spread of measles is the MMR vaccine. There are now more than 640 confirmed cases of measles across 22 states. Almost 500 of them are in Texas. Now, cases of measles have been confirmed as close as Ontario. Our Sarah Mikowitz caught up with a local pediatrician who's concerned it's only a matter of time before someone in our region gets sick with the measles. Sarah?
Dave, more than 600 cases of measles have been confirmed in Ontario, Canada. Local health experts say this virus is highly contagious and can be deadly, but it is preventable.
Measles is the canary in the coal mine. It's so infectious that if we have pockets of individuals that aren't vaccinated or have those lower rates of vaccination for cases introduced in the community, it spreads quite readily.
After once being eradicated in the U.S., measles cases are back and on the rise in the U.S. and in Canada. Jacobs School of Medicine infectious disease expert Dr. Thomas Russo says it's concerning. He stresses how important and effective the measles vaccine is.
Vaccination does a great job in preventing against infection, but if we have unvaccinated individuals or vaccination rates drop below a 95% level, we're going to see infections, and unfortunately that's what's occurring right now in certain parts of the country.
Health experts say the measles vaccine is 93% effective with the first dose and 97% effective with the second.
It's, found to be a very safe and effective method to protect the children from, a potentially deadly disease. And it's really sad that we're seeing in this century a disease that had been eradicated coming back and causing death in children.
Dr. Kathleen Crisanti from Pediatric and Adolescent Urgent Care of Western New York says her office in Orchard Park already has procedures in place if a patient shows symptoms.
We've put in precautions in place, so if a parent brings a child in with a generalized rash and fever, we ask them to wait in the car until it's their time to be put directly into a room. We mask up and take precautions for our staff.
Dr. Crisanti says it is alarming that hundreds of measles cases have been confirmed just a short distance from Western New York.
It's very alarming that there's so many cases in Canada, with the majority of the cases, over 650 cases in Ontario. So we feel like it's only a matter of time before it's going to really infiltrate into the Buffalo region.
Dr. Crisanti urges parents whose children are not vaccinated for measles to reconsider and get them vaccinated. Before making any decision, though, she says speak to your children's pediatrician. In the studio, Sarah Mikowitz, News 4.